Every 66 seconds, another senior is diagnosed with dementia. By the time you finish this video, roughly 20 more families will hear those words from a doctor. Most people assume memory loss is simply part of aging, but what if the real culprit is sitting quietly in your medicine cabinet? Pills you've trusted for years, even decades, may be undermining your brain while promising relief for sleep pain or heartburn. Here's what the research shows. Certain widely used medications can shrink the very centers of the brain responsible for memory by more than 28% in under 12 months. Yet almost no one is warned. For decades, pharmaceutical companies have known about these risks while continuing to make billions from prescriptions that may be speeding up decline in millions of seniors. In fact, a major 2023 study in neurology and aging research discovered something alarming. Just 2 years of taking a common class of drugs raised the risk of dementia in seniors by 49%. That's nearly 1 in 2. In this video, we'll count down the 9 most dangerous medications linked to rapid memory decline, moving from those often dismissed as harmless to the ones that can devastate your mind. Pay special attention to number 3. It's prescribed to millions for something minor, yet it can physically shrink memory centers in the brain. Before we dive in, drop a comment below and share your story. What medications are part of your daily routine? Have you ever noticed sudden brain fog or unexplained forgetfulness? We read every single comment and respond with personalized insights. Don't stay quiet. Your experience could save someone else's memory, maybe even your own. Don't be fooled by its low rank on this list. This drug is hiding in almost every senior's cabinet, and it may be scrambling your brain before you even realize it. Number 9 is diphenhydramine, better known as Benadryl. It's that familiar pink pill millions trust for sleep, allergies, or even the common cold. It's cheap, it's over the counter, and there's a good chance you have some in your nightstand right now. On the surface, it feels harmless, just something to help you rest or breathe easier. But inside your brain, the story is very different. Diphenhydramine belongs to a class of drugs called anticholinergics. These medications block acetylcholine, a key neurotransmitter that allows your brain to form new memories and stay mentally sharp. The hippocampus, your brain's memory hub, depends on it. As you age, your brain relies even more heavily on every bit of acetylcholine it has left. When diphenhydramine interferes with this process, the effects can be devastating. A 2023 study published in the Journal of Geriatric Cognitive Health found that seniors who regularly used anticholinergic drugs faced a 54% higher risk of developing dementia compared to those who did not. That's more than half, again, the normal risk just from taking something many people assume is safe. So how can you protect your memory? The first step is awareness. Be cautious with anything labeled PM, nighttime, or allergy relief. Most of these are simply diphenhydramine in disguise. If you're using it for allergies, consider switching to newer non-sedating antihistamines like loratadine, sold as Claritin. These alternatives don't cross the blood-brain barrier and are far safer for long-term use in older adults. Benadryl may promise rest and relief, but for your brain, the cost could be far too high. Never stop a medication suddenly, but also never assume that over-the-counter means safe. At number 8 on our list are drugs often marketed as gentle on your stomach, yet quietly harmful to your brain: proton pump inhibitors, or PPIs. You probably know them by brand names like Prilosec and Nexium. These medications are designed to reduce stomach acid and are commonly prescribed for heartburn, GERD, and acid reflux. Many seniors remain on them for years, even decades, because symptoms often return the moment they stop. But here's the problem: almost no one talks about PPIs block your body's ability to absorb vitamin B12. This nutrient is essential for protecting your brain, sharpening memory, improving focus, and stabilizing mood. The risks don't stop there. A 2016 study published in JAMA Neurology followed more than 7,300 adults age 75 and older. It found that regular PPI users faced a 44% higher risk of developing dementia compared to non-users. The reason is clear: by suppressing stomach acid too aggressively, PPIs also reduce absorption of magnesium and calcium minerals that neurons depend on for firing signals efficiently. Without them, nerve cells misfire, leading to confusion, brain fog, and memory lapses that can look eerily similar to the first signs of Alzheimer's disease. Even more alarming, PPIs have been shown to raise levels of amyloid beta plaques in the brain, the toxic proteins directly linked to Alzheimer's progression. But there is good news. If you're taking PPIs daily, talk with your doctor about tapering off gradually. Safer options include H2 blockers like famotidine sold as Pepcid, which are less likely to impair cognition. And for natural relief, consider chewing deglycyrrhizinated licorice, a herbal compound that gently soothes the stomach lining without harming your brain. PPIs may calm your stomach, but over time, they can silently steal your clarity. Coming in at number 7 is a medication millions take for bladder control, but it may be quietly wrecking both short-term memory and emotional balance. The drug is oxybutynin, sold under the brand name Ditropin, often prescribed to seniors struggling with urinary incontinence or an overactive bladder. At first glance, it feels like a practical solution. No one wants the embarrassment of constant bathroom trips. But beneath the surface, the cost to your brain can be steep. Oxybutynin works by blocking acetylcholine, the same vital brain chemical disrupted by Benadryl. Unlike weaker anticholinergics, however, oxybutynin crosses the blood-brain barrier, more easily striking memory hubs in the hippocampus directly. That's what makes it especially dangerous for older adults. A 2019 study published in the BMJ found that people over 65 who used strong anticholinergic drugs like oxybutynin for more than 1 year had a 49% higher risk of developing dementia, nearly 1 in 2. The troubling part is that most seniors are never warned about these risks. They're told it will help manage bladder control without mention of how it may accelerate mental decline. The symptoms often masquerade as normal aging brain fog, forgotten appointments, misplaced items, or difficulty keeping track of conversations. By the time anyone connects the dots, damage may already be underway. The good news is you're not stuck. If you're taking oxybutynin and notice memory or mood changes, speak up, it's not just in your head. Newer medications like mirabegron, sold as Myrbetriq, work through a different pathway and show far less impact on cognition. You deserve bladder relief without sacrificing your mind. With the right choices, you can protect both. At number 6, we turn to one of the most prescribed drug classes in the world, statins. Millions of adults over 60 take them every day to lower cholesterol and reduce the risk of heart attacks or strokes. Simvastatin Zocor and atorvastatin Lipitor are two of the most common. But here's the catch. Cholesterol isn't just a heart concern, it's a brain necessity. Your brain is nearly 60% fat, and cholesterol plays a vital role in building and maintaining the myelin sheath, the protective coating that allows nerve signals to travel smoothly. When cholesterol is lowered too aggressively, the brain may be deprived of the raw materials it needs to function at its best. A 2023 study in Frontiers in Aging Neuroscience revealed that seniors over 70 who used statins for more than 3 years faced a 26% higher risk of mild cognitive impairment. Those on high doses reported even sharper declines. Some patients described sudden memory lapses, forgetting names, losing track of recent conversations, or even getting disoriented on familiar driving routes. The picture isn't all bad, though. Not all statins affect the brain equally. Certain types like pravastatin and rosuvastatin don't cross the blood-brain barrier as easily and are generally considered safer in terms of cognitive side effects. If you've been on a statin for years and notice brain fog, forgetfulness, or confusion, don't dismiss it as just getting older. Talk to your doctor about adjusting your dose or exploring safer alternatives. Protecting your heart is important, but not at the expense of your mind. Number 5 on our list is one of the most common quick fixes for anxiety and insomnia: benzodiazepines. Drugs like lorazepam, Ativan, diazepam, Valium, and alprazolam Xanax are prescribed by the millions. At first, they seem like lifesavers. They calm racing thoughts, ease panic, and help with sleep. But over time, they turn into something far more dangerous: a chemical trap. Here's why. Benzodiazepines work by enhancing GABA, the brain's calming neurotransmitter. In the short term, this feels like relief. But long-term use slows neural activity so much that the brain begins to lose its flexibility. Learning slows, memory weakens, and emotional sharpness fades into dullness. The science is sobering. A 2022 study published in the BMJ tracked more than 8,000 seniors over 6 years. It found that those who used benzodiazepines for more than 3 months had a 51% higher risk of developing Alzheimer's disease. The danger was even greater with long-acting versions like diazepam, which linger in the body and accumulate in brain tissue. Many seniors describe the experience as living in a fog, disconnected, forgetful, not quite themselves. And the worst part comes when they try to stop. Withdrawal can bring crushing anxiety, agitation, and severe insomnia, making the drug feel essential when in reality it's fueling the problem. So, what's the solution? First, never stop suddenly. Doing so can be dangerous. If you've been on a benzodiazepine for more than a few weeks, talk with your doctor about a careful gradual taper. Safer alternatives exist. Buspirone, a non-sedating anti-anxiety medication, can ease symptoms without impairing memory. Cognitive behavioral therapy, CBT, for anxiety or insomnia has also proven highly effective, helping many seniors regain calm naturally. These drugs may promise peace, but the price could be your mind. With the right guidance, you can reclaim both your sleep and your memory. At number 4 is a medication many seniors still receive today, amitriptyline, sold under the brand name Elavil. It's an older antidepressant, but doctors continue to prescribe it for nerve, pain, insomnia, and even migraines. On the surface, it looks like a multi-purpose solution, a pill that promises relief in many forms. But beneath that promise lies one of the most powerful anticholinergic drugs still in circulation. Here's the problem. Amitriptyline strongly blocks acetylcholine, the neurotransmitter that allows your brain cells to communicate, form new memories, and stay sharp. The blockade is so potent that cognitive side effects aren't just possible, they're expected, especially with long-term use. A large 2015 study published in JAMA Internal Medicine tracked over 3,400 adults aged 65 and older for a full decade. The results were striking. Seniors with higher cumulative exposure to anticholinergic medications, like amitriptyline, had a 54% greater risk of developing dementia. That's not a minor uptick, it's more than half, again, the normal risk. What makes this so concerning is that most patients are never warned. They're given amitriptyline for sleep or pain, and then over the years, they start noticing subtle changes, difficulty recalling names, trouble finding the right words, foggy concentration. These symptoms often get dismissed as normal aging, when in reality, they may be drug-induced brain decline. And it doesn't take a high dose to cause harm. Even a low nightly dose taken over several years can slowly erode mental clarity. The damage builds silently, no flashing warning signs, just a gradual decline that looks like Alzheimer's but is actually preventable. So what's the safer path forward? If you or a loved one is on amitriptyline, speak with a physician about alternatives. For nerve pain, medications like duloxetine or gabapentin may offer relief with less anticholinergic burden. For sleep, melatonin or low-dose doxepin are gentler on the brain. And for mood support, newer antidepressants like sertraline or escitalopram are generally considered much safer. Relief doesn't have to come at the cost of your memory. With the right choices, you can protect both your comfort and your cognition. At number 3 is a medication that looks modern and safe on the surface, but hides a dangerous secret: paroxetine, sold under the brand name Paxil. It's one of the most commonly prescribed SSRIs, selective serotonin reuptake inhibitors, for depression and anxiety. At first glance, it seems like an upgrade over older antidepressants, promising gentler side effects and reliable mood support. But here's the detail that few people are told: Paxil is the only SSRI with strong anticholinergic properties. That means it interferes with acetylcholine, the chemical your brain needs to form memories, stay focused, and regulate attention. This single difference sets it apart from safer siblings like sertraline Zoloft or escitalopram Lexapro. The science confirms the danger. A 2021 review published in Frontiers in Psychiatry tracked elderly patients on different SSRIs. Those taking paroxetine showed measurable declines in short-term memory, verbal recall, and attention span within just 12 months. Even more concerning, they were 30% more likely to develop early signs of cognitive impairment compared to seniors on other antidepressants. The irony is painful. A drug prescribed to stabilize mood may end up eroding mental clarity and emotional balance over time. Many patients never connect the dots until symptoms have already progressed. The solution, however, is straightforward. The American Geriatric Society has placed paroxetine on its Beers criteria, a list of medications considered potentially inappropriate for older adults. If you or a loved one is on Paxil, it's essential to ask your doctor about safer alternatives, such as sertraline or escitalopram. And to further support brain health, supplementing with B vitamins, especially B12 and B6, can help strengthen both mood and memory naturally. Paxil may look like a modern antidepressant, but for seniors, its hidden costs can be steep. Choosing wisely means protecting not only your mood, but also your mind. Number 2 is especially alarming because many seniors don't even realize they're taking antipsychotics. Drugs like quetiapine, Seroquel, risperidone, Risperdal, and olanzapine, Zyprexa, were originally developed to treat severe psychiatric disorders, such as schizophrenia and bipolar disorder. But today, these powerful medications are frequently prescribed off-label to elderly patients for sleep issues, agitation, or behavioral changes linked to dementia. In nursing homes and hospitals, they're often given to seniors who are simply restless, confused, or difficult to manage, not because they truly need psychiatric treatment. The consequences can be devastating. A 2022 study published in the Lancet Healthy Longevity followed more than 2,500 older adults. It found that seniors prescribed antipsychotics for behavioral symptoms were 71% more likely to experience worsening cognitive decline within just 12 months, even if they had no prior history of dementia. And the risks don't stop there. These drugs increase the chance of stroke, sudden death, and profound sedation, which can lead to falls, hospitalization, or even permanent institutionalization. The mechanism is harsh. Antipsychotics suppress dopamine, a neurotransmitter essential not only for mood and motivation, but also for executive function and memory processing. When dopamine levels collapse, the brain slows, becomes unresponsive, and loses its spark. That's why many seniors on antipsychotics appear dull, flat, or even zombified. Families often describe the heartbreak of watching a loved one fade away while their body is still present. Correcting this begins with asking tough questions. If you or a loved one is on an antipsychotic, ask the doctor why it was prescribed and whether it's truly necessary. In many cases, non-drug approaches can work. Structured routines, reduced noise, and overstimulation, addressing pain or discomfort, and improving lighting or sleep hygiene. When medication is absolutely unavoidable, using the lowest effective dose for the shortest possible time can reduce harm. But far too often, these drugs are used out of convenience, not necessity. The tragedy is that families may never be told what's really happening. They see decline and assume it's natural aging, when in reality, it's chemical. At number 1, the greatest danger isn't a single pill, it's the hidden weight of many. This threat is called anticholinergic polypharmacy, and almost no one talks about it. Instead of one drug causing damage, it's the silent cumulative effect of taking multiple medications that all block acetylcholine, the chemical your brain depends on for memory and alertness. Picture this: a senior takes diphenhydramine at night to sleep, oxybutynin for bladder control, and amitriptyline for pain. Alone, each drug might cause only mild forgetfulness. Together, their effects compound, and the anticholinergic burden skyrockets. This isn't just a theory. A 2022 study in Age and Aging tracked over 2,800 older adults. Those with the highest cumulative burden had a 120% greater risk of developing dementia within 10 years, more than double the normal risk. What makes this even more dangerous is that most seniors don't realize they're on anticholinergic medications at all. They're told the drugs will help them sleep better, ease pain, or control symptoms, but never warned about the hidden costs. When acetylcholine is blocked from multiple angles, the brain doesn't just slow down, it begins to decay. Neurons shrink from underuse, synapses wither, and the brain slips into a hypoactive state that looks almost identical to Alzheimer's disease. But here's the hopeful part. Drug-induced dementia is often reversible. Fixing it doesn't require a miracle, it requires a medication review. Ask your doctor or pharmacist to evaluate every prescription, over-the-counter drug, and even supplement you take for their anticholinergic load. Professional tools can calculate this cumulative score. Once identified, you and your healthcare provider can create a plan to deprescribe, gradually tapering off unnecessary medications, switching to safer alternatives, and rebalancing brain chemistry. The results can be life-changing. Many seniors regain clarity, energy, and sharper memory within weeks or months of reducing their anticholinergic load. The brain is remarkably resilient if given the chance. Anticholinergic polypharmacy isn't just dangerous, it's preventable, and that makes it the #1 hidden medical threat to the minds of our aging population. Now it's your turn. Which of these medications are part of your daily routine? Have you noticed brain fog, forgetfulness, or subtle changes in mood or personality since starting them? Most importantly, are you willing to speak with your doctor this week about reviewing your prescriptions for safety? Share your story in the comments. We read every single one. Your experience could help protect not only your memory, but someone else's as well.